Hello everyone, I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. Welcome to Dr. Ozello's Sports Medicine Report. Today I'm going to do things a little bit differently. Today I'm going to speak about an exercise, specifically a modification of an exercise. The calf press is an excellent exercise used to strengthen the calf muscles, specifically the gastrocnemius muscles and the soleus muscle. Many times people find this difficult if they have a knee condition. It could be an acute condition, could be a chronic condition, or many times seniors, they just have a difficult time doing the calf press. So the modification is to perform it with slight knee flexion, which means that the knees are bent slightly. This takes pressure off of the knee joint and still works the gastrocnemius and the soleus muscle very well. The calf press is an exercise that directly targets the gastrocnemius and the soleus muscles. These are the powerful muscles located in the back of the lower leg. Traditionally, the calf press is performed with the knees in full extension or even in hyperextension. This position places pressure on the knee joints. A simple variation places less pressure on the knee joints. Therefore, it can be utilized by older lifters or lifters with a previous knee injury or a chronic knee condition. The knees are held in slight flexion throughout the entire set to lessen the pressure placed on the knees. The calf press is performed on the leg press machine, and it is an exercise that will help you to strengthen the gastrocnemius and the soleus muscles and the Achilles tendon. Now I'm going to give you a quick anatomy lesson. I'm going to go over the gastrocnemius, the soleus, and the Achilles tendon. The gastrocnemius muscle has two heads and it crosses two joints. The origin of the medial head of the gastrocnemius muscle is the medial condyle of the femur. The origin of the lateral head of the gastrocnemius muscle is superior to the articular surface of the lateral condyle of the femur. They insert into the posterior aspect of the calcaneus, which is the heel bone, via the Achilles tendon. The gastrocnemius is innervated by the tibial nerve, which is a branch of the sciatic nerve from vertebral levels S1 and S2. And the concentric actions of the gastrocnemius muscle are plantar flexion and knee flexion. The soleus muscle is located deep to the gastrocnemius muscle. The origin of the soleus muscle is the fibula and the medial border of the tibia along the soleal line. It inserts into the posterior aspect of the calcaneus via the Achilles tendon. It is innervated by the tibial nerve, and the concentric action of the soleus muscle is plantar flexion. The Achilles tendon is also known as the calcaneal tendon. This is the thickest tendon in the entire human body, and it attaches the gastrocnemius and soleus muscle to the calcaneus bone. Disclaimer alert, please remember that watching this video does not take the place of seeing a medical professional, and it does not take the place of working with a fitness professional, a strength and conditioning coach, or an athletic trainer. Please see a medical professional before starting any type of exercise program, and please work with a fitness professional or a strength and conditioning coach to learn proper technique. Please always perform all exercises through a symptom-free range of motion. Never perform an exercise that elicits or intensifies symptoms. If an exercise elicits or intensifies symptoms, stop immediately and find a viable substitute. Please start any exercise at your current health, fitness, and strength levels, and increase the intensity and volume of your exercise in very small, gradual, calculated increments. The standing calf raise is performed with the knees extended and directly targets the gastrocnemius and the soleus muscles. The seated calf raise is performed with the knees flexed 90 degrees and targets the soleus muscle. It also targets the gastrocs, but it is one of the best exercises for targeting the soleus muscle. I mentioned the standing calf raise and the seated calf raise because when you are performing the calf press on the calf press machine, it is very similar to the standing calf raise in the way that it targets the gastrocnemius muscles and the soleus muscle. But when you have the knees flexed, it becomes a combination of the standing calf press and the seated calf press. You're obviously not going to have the knees flexed 90 degrees, but they're going to be slightly flexed when you are performing this variation of the calf press. This is going to help to target the gastrocnemius and the soleus muscle without placing additional pressure on the knee joint. So go ahead and try this variation of the calf press. The knees should be held in slight flexion throughout the entire set. You want to use proper technique through a symptom-free range of motion. Move in a slow and controlled manner and control the eccentric phase of the exercise. Having strong calf muscles is vital in all aspects of life, but especially in sports. You think about runners, jumpers, lifters, racket sports players, any type of sport where there is motion, you need to have strong calf muscles. So give it a try and let me know what you think. You can put any questions, feedback, or suggestions in the comment section below. Thank you very much for watching today's video. I am Dr. Donald Ozello of Championship Chiropractic in Las Vegas, Nevada. I am the author of Running, Maximize Performance, and Minimize Injuries. You can go to my website, championshipchiropractic.com, where you can find additional information on the book, and you can also find my blog. My blog contains articles on spine health, chiropractic care, sports medicine, health, fitness, nutrition, and exercise. Please feel free to like this video. Again, if you have questions, feedback, or suggestions, please leave them in the comment section below. Please subscribe and always remember to train hard, but train smart. Get adequate rest between your training sessions. Utilize nutritional and supplementation strategies that work for you. Stay injury-free, rehabilitate your injuries, and accomplish your goals.